Most Americans have heard the word Obamacare, but a lot of people still don't really understand what it is, how it works, or what it could actually do for them. Some people think Obamacare is an insurance company, others think it's a government health insurance plan, and some people assume they make too much money to qualify for any help. So, for the next few minutes, forget the politics and the headlines. I'm going to explain Obamacare in plain English and tell you what you should actually know before choosing health insurance. First, Obamacare is simply the commonly used name for the Affordable Care Act, or ACA. It's not an insurance company. When you enroll through the health insurance marketplace, your coverage generally comes from a private insurance company participating in your area. The ACA created rules for that coverage and established financial assistance that can make marketplace insurance more affordable for eligible households. And that brings us to one of the most misunderstood parts of Obamacare: premium tax credits. Depending on factors such as your household income, family size, where you live, and other eligibility requirements, you may qualify for financial assistance that reduces what you pay each month for your health insurance. For some eligible households, that assistance can be significant, but your situation is unique, so don't assume you qualify or don't qualify based on what happened to a friend, neighbor, or family member. Here's another important point. A $0 monthly premium does not mean free healthcare. This causes a lot of confusion. If financial assistance reduces your premium to $0, you could still have a deductible, copays, coinsurance, prescription costs, and other out of pocket expenses when you use healthcare services. That's why I don't recommend choosing health insurance based solely on the monthly premium. Let me give you an example. Imagine you're comparing two plans. One costs less each month but has a higher deductible, and your preferred doctor isn't in the network. Another costs a little more each month but has a lower deductible, better prescription coverage, and includes your doctor. Which one is cheaper? You can't answer that by looking at the premium alone. The right question is, which plan gives me the best overall value based on the healthcare I actually expect to use? Another major protection under the Affordable Care Act involves pre-existing conditions. A CA-compliant marketplace plans cannot deny you coverage or charge you a higher premium simply because you have a pre-existing health condition. That's an important part of the law that sometimes gets lost when people only talk about premiums. You also need to understand provider networks. Just because an insurance company has your doctor in one of its plans doesn't necessarily mean that doctor participates in every plan offered by that company. Before enrolling, check the specific plan's network. Look at your primary care doctor, specialists, hospitals, and other providers that are important to you. The same thing applies to prescription medications. Don't simply ask, does this plan cover prescriptions? Look up the medications you actually take. Different plans can place the same drug on different tiers, and your costs can vary. There may also be requirements such as prior authorization or step therapy. Taking a few minutes to check before enrolling can prevent an unpleasant surprise later. Here's another mistake I see: automatically renewing the same marketplace plan every year. Your current plan may have worked great this year, but that doesn't guarantee it's your best choice next year. Premiums can change, deductibles can change, copays can change, provider networks and prescription formularies can change. New plans may become available, and other plans may leave your area. That's why you should review your options every year instead of treating your marketplace insurance like something you can simply set and forget. Your marketplace application also needs accurate information. Household size and expected annual household income can affect eligibility for financial assistance. If important information changes, make sure you understand whether your marketplace application needs to be updated. The premium tax credit is connected to your tax situation, so providing accurate information matters. And here's something else many people don't realize: you don't necessarily have to figure all of this out by yourself. A licensed health insurance agent or broker can help you understand available marketplace plans, compare costs and benefits, check provider networks and prescriptions, and help you understand the enrollment process. For eligible marketplace enrollments, consumers generally don't pay an additional premium simply because they use an agent or broker. So, what should you remember from this video? Obamacare is the Affordable Care Act. Marketplace coverage generally comes from participating private insurance companies. Eligible households may qualify for financial assistance. A $0 premium doesn't mean zero healthcare costs. And before choosing a plan, Look beyond the premium and compare the deductible, copays, out-of-pocket maximum, doctors, hospitals, and prescription coverage. Most importantly, don't make your health insurance decision based on a headline, a social media post, or what someone else pays. Your situation is your situation. At Shields and Associates, we help individuals and families understand their marketplace health insurance options and determine what financial assistance they may qualify for. If you'd like help reviewing your options, call Shields and Associates at 402-54-589-54. And if this video helped you finally understand Obamacare a little better, give it a like, subscribe to Shields Insurance Explained, and turn on notifications. We create these videos to make Medicare, marketplace health insurance, and other insurance topics easier to understand. Thanks for watching, and I'll see you in the next video.